Oye, Pepe, dame un café, chico.
Hi everybody, Rick Gonzalez-Rothi here with Mango for You, where we talk about health, writing, literature, and odd and unusual things. Today's video is a sequel to the Happy Juice video I did last week. So I ask about coffee. Is it healthy? Is it safe? I thought I would talk a little bit about coffee and its effect on health. Coffee comes from a plant. And, many of my patients often tell me, well, but it's okay because it's all natural. I do remind them that so is hemlock. It's natural, but doesn't necessarily mean it's safe. So just about everything that you take has a potential for some harm and some good. And there are very few things that you take by mouth or by any other route that are really health neutral. Nevertheless, over the years, some notable individuals like Johann Bach and Beethoven, music composers, were known to drink 40, 50 cups of coffee a day. And even our American friends, Ben Franklin, was known to frequent many coffee houses. In fact, some people feel that the clarity of much of his thinking was quite enhanced by coffee, because at that time most people used to drink beer for breakfast. You might not also know that President Teddy Roosevelt was probably one of the largest American coffee drinkers. It is said that sometimes he would drink a gallon of coffee a day.
Now let's get down to business.
Phytochemicals are substances which are derived from plants, phyto, P-H-Y-T-O, and which may have some drug effects. There are many phytochemicals in coffee. In fact, coffee has over 1,000 different chemical structures in the plant, but there are two major ones, of which caffeine is really the major one.
Say it.
Pharmacodynamics. Pharma meaning from medications, dynamics meaning from the word power. The pharmacodynamics of anything that we ingest are very important because they reflect the variability from person to person, and why some people may take a smaller amount of a substance and have very powerful effects, or others have to take large amounts in order to have the same effect. When you take something like a plant-based material, like coffee, and you ingest it, it usually takes about 30 to 60 minutes for the level of caffeine to become highest in your bloodstream. And about 3.5 to 5 hours, the original dose of caffeine that you ingested is cut down to half.
The pharmacodynamics of caffeine depends not only on how much you ingest, but how quickly your body breaks it down or eliminates it. Since most of the caffeine that you ingest is broken down by your liver, you can imagine how somebody with liver disease might have the caffeine hang around in their body longer than somebody who has a normal liver.
All right, let's turn now to the bad about drinking coffee.
An 8-ounce cup of coffee contains about 100 milligrams of caffeine. By the time you take 4 cups of coffee a day, that is pretty much the upper limit of what most people can safely drink over a one-day period without getting into potential adverse effects. On the left side of this slide here, I have shown you in green what can happen to people as usually temporary adverse effects of drinking coffee. Some people experience headache, other people can have a fast or irregular heartbeat with it, and many people get anxious and are jittery. Loose stools is something that people sometimes complain about, and because coffee promotes urination, a loss of bladder control for some people can be a problem after they drink a cup of coffee. Lastly, coffee, particularly in higher doses, can cause transient increases in the eye pressure So that is something for people who have glaucoma to be concerned about. Again, most of these effects listed in green here are very transient, they're not long lasting, and they go away after the caffeine from drinking coffee wears off. Because of the half-life of coffee, as I mentioned earlier, it's probably not a good idea to drink coffee for at least 6 hours before you go to bed, or you're probably going to stay awake. On the right side of this slide, I've listed some adverse effects that have been noted in multiple studies, and these are not transient effects. They can develop over time in people who have been drinking coffee for a period of time. One of concern can be that in some women, particularly if they drink high amounts of coffee on a daily basis, they can develop thinning of their bones or osteoporosis, or it can be aggravated if they already have it. For pregnancy, most women can probably drink small amounts of coffee, 1 or 2 cups a day. In fact, the American College of Obstetrics recommends pregnant women not exceeding 2 cups of coffee or around 200 milligrams of caffeine a day. But this, of course, can vary in many people, and of course, there have been associations between coffee drinking and miscarriage, or SIDS, sudden infant death syndrome, as well as low birth weight births in children of women who are heavy coffee drinkers. I should also mention that people who drink coffee, the coffee gets transmitted to the breast milk, so it should be something that people should note, particularly if the baby gets jittery or has loose stools.
Well, just a few more considerations when taking coffee which contains caffeine. There are some drugs that you normally take that can affect the clearance of caffeine from your body. And I think it's important to know about this because they're very common drugs. There are some antibiotics that are called fluoroquinolones that can do this. Birth control pills can do this as well. A common acid reducer pill called cimetidine can do this, and a blood pressure medication called verapamil can also delay the clearance of caffeine from your body. For people with certain medical conditions, it's also important to realize that coffee can have some effects. For example, if you drink coffee and you take a
Thyroid hormone supplement,
it may reduce the amount of hormone that's absorbed into your body when you're drinking coffee. For people with bipolar disorder who are on lithium, caffeine from coffee may reduce the blood lithium levels. And lastly, caffeine in your body can reduce the ability of your blood to clot. So this is especially important for people who are on blood thinners. You should probably check with your doctor about possible effects of coffee and how well your blood clots. Well, that's about it in terms of potential things that could lead to adverse events of drinking hemp juice.
Now let's turn to reviewing some of the positive effects that have been associated with coffee drinking. There are many studies now that have looked at the risk of various illnesses and conditions in people who are coffee drinkers versus people who are non-coffee drinkers, and in addition have looked at how much coffee is consumed on average by those who drink coffee and related it to risk of different health conditions. The first good news is that if you happen to be a coffee drinker, you're less likely to die from any cause than if you're not a coffee drinker. People who drink coffee also are less likely to have stroke and heart disease, and they're less likely to develop heart failure. When it comes to neurodegenerative diseases such as Parkinson's disease and psychiatric conditions such as depression, it looks like people who are coffee drinkers are less likely to develop Parkinson's disease and depression. Now, there have been many cancers that have been looked at in people who drink coffee and non-coffee drinkers, but there's been consistent reductions in the risk of developing liver, prostate, and thyroid cancers in people who drink coffee. In addition, there seems to be a lower incidence of liver diseases such as fatty liver and cirrhosis of the liver in people who are coffee drinkers. And finally, there's less of a chance of getting gallstones if you're a coffee drinker. Now, I should state that there's kind of a sweet spot here, and many of the studies that I've looked at the coffee consumption show the highest effect on people who drink at least 3 to 4 cups of coffee, or the equivalent of about 300 to 400 milligrams of caffeine a day. So this is all really great news, and I think we can be fairly confident that there are sufficient studies in the scientific literature to substantiate this.
Looks like it's time to put on the happy shirt. Well, there you have it. That's the story about the health and happy juice. I drink coffee because I like it. But there are a couple of other effects that have been shown and validated by scientific studies that I didn't share with you, but that are pretty obvious. For one thing, coffee increases my alertness.
Yes!
Yeah. Another thing, it also improves my thinking skills. That too. So I'm glad to know that Happy Juice tastes good and that overall it has many health benefits. I think it's important for you to make your own decisions as to what you think about drinking coffee. And you need to understand that you should balance how much you drink, if you are going to drink it, with the potential adverse events that it could cause you, as well as the long-term health benefits. Also understand that not every cup of coffee has the same amount of caffeine, and it depends a lot on how strongly it is brewed, etc. If you have any doubt, you should probably speak with your doctor if you're considering drinking coffee on a regular basis, or you think you might be having some problems with it. Salud!